Good morning and good evening, everyone. It is my pleasure to invite all the participants for the focus group discussion between the students of India and USA. And this program is hosted by Trained Nurses Association of India. The association was started in the year 1908 and has voiced out very many concerns of nurses in India. Now, may I request the President of Trained Nurses Association of India, Dr. Roy K. George, to introduce the International Nurses Day theme and say a few words about TNAI.
Thank you, Dr. Leda. Good morning and good evening to all the respected nurses and nursing students present in this discussion. First of all, let me congratulate and thank Dr. Leda and Dr. Christina for initiating a discussion on the international related to the International Nurses Day theme of 2021 between future leaders of two countries, the current students. So I am hosting this meeting as the National President of TNAI. As Leda told, it is the Trained Nurse Association of India, which is more than 113 years old association, which was established by nurses from abroad in 1908 in India. It continues to be an association of the profession, having membership in all the fields, whether government nurses, private nurses, or educationalists, academicians, researchers, public health nurses, and also we have a very strong student wing, Student Nurse Association, which is primarily ensuring development and welfare of students, because we believe today's students are going to be tomorrow's leaders, and leadership has to be nurtured at the entry stage to the profession itself. As for TNA has been voicing nurses' concerns in India for more than a century, especially for those who are joining us from the United States. Now, India is a developing country. The health sector is still developing, and there are many issues to be addressed as far as nurses and nursing profession is concerned. There are miles to go, though we are making changes continuously. We are trying for changes, and some of them are happening. Being a developed country, of course, we all know very well the situation between India and US has a lot of differences, and there are also a lot of nurses exchange which was happening from so many nurses from India has migrated to US, and we have a close connection with the nursing profession in countries like United States of America. And when you talk about International Nurses Day, first of all, greetings of the International Nurses Day to all the nurses and nursing students who are here. And this year's theme is a continuation of the previous themes, Nurse Voice to Lead. But the second part, Vision for the Future, that is very, very important, because leadership is not an overnight affair. It has to be groomed, nurtured, and developed through the years of mentoring and modifications. So when we look at the leadership for the future, we have to look at the youngsters who are budding professionals or who are just young graduates who are just entered the profession. So traditionally, in many places in the world, though nursing has changed a lot, there is a lot of orthodoxy or resistance to change. Though we all say change is the only permanent thing, generally I have felt in my last 35 years of experience in the profession, many times we feel that nursing, the changes happening in nursing are many times slower than many other professions. There are inherent problems, multiplicity of issues, but still many times what I have personally felt is the seniors in the profession, like me and many others like Dr. Christina, Dr. Leda, are still to modify our attitude towards the youngsters in the profession so that they will come up more I'm not saying that myself or Lata or Dr. Christina or the faculty here are resistant to change, but generally the senior lot has to promote ideas, initiatives, and leadership skills in the youngsters so that youngsters will come up with new ideas and that may take a lead in changing the profession's current status. It shall jump ahead, because if you nurture them from the beginning, like if I take, because I'm representing TNA, as a student, I have felt the Student Nurse Association is not very democratic. It has got a rigid structure. And when I became the National President of Trained Nurse Association of India, one of the agenda in our association's programs for the next 2 years is that we have to restructure Student Nurse Association, where students get more democratic rights and more freedom to decide and more freedom to lead, so that we will be able to identify the leadership talents or the leading stars in the profession. So these are things which should have happened earlier, but there was resistance. Not everywhere in the world it is like that, but traditionally, when I take the Indian perspective, there are a lot of resistance to change. When this agenda came about 10 years back in our general body meeting, when students told, no, we don't not any change because this is better. Maybe because the teachers have trained them to answer like that in a general body meeting. What I'm saying is that the theme of the International Nurses Day is very relevant, and this discussion is definitely a very good step where the students express their ideas and also ask questions to seniors where we can answer and interact with them, which will be definitely beneficial for them, but much more beneficial for us, the seniors, because we get fresh ideas, and also will know what the tomorrow's leaders feel about nursing today and what is their vision for the future. So once again, thank you everyone who are joined, especially Dr. Lata and her students, and also Dr. Christina and her faculty members and students. We look forward to a very active discussion. Thank you very much.
Thank you, sir. Thank you very much. Now, may I request the faculty from Los Angeles to introduce themselves.
Sorry. Hello, I'm Christiana Bhaskaran. I'm the Director of Nursing in a community college at Los Angeles. And I am very privileged to introduce our faculty who join here, as well as the students from Los Angeles Community College. So I have, can you show Dr. De La Cruz? So I have Dr. De La Cruz, Ruth De La Cruz. She's our first semester faculty and well-experienced clinician. She's also an emergency, department educator. She worked as an emergency department educator for a long, so many years, okay, in prestigious hospitals in Los Angeles. And we are very privileged that she has joined us as faculty with us, and she's handling our first semester students. And we are very happy that our students are learning from her experience. Okay, I also want to introduce our students who joined here. I have Fiona, can you show you on the screen? Maybe you can spotlight the individuals, okay. Okay, so I have Fiona here. She's our graduating student, highly skilled, possessed with a lot of leadership quality. From the day one, she's exhibiting that quality as a leader, emerging leader. We can always see that. And, I'm very happy that she joined the discussion today. I have next is Roger Salas. Can you please show him in the screen? So I have Roger here. He is our fourth semester graduating student, very intelligent, and he's quiet, but he is very knowledgeable. Yes, and he's going to share his expertise today with us. Okay, I have, and the next one is Joseph. Joseph Santos. He is our graduating student, and he's a very interesting student. And he kind of he makes everybody happy, right? And then yes, you guys can jump in too. And we really love his company, and he's very always interested, motivated, encouraging others, that kind of a personality. So in a class, we need everyone, right? Okay. So thank you for joining in this discussion. I have Rachel here. Okay. So Rachel is also a very calm and quiet student, and she's in the graduating class, and she's always helping Fiona in running the class, like, any issues, like they both handle, but she's a right and left hand for Fiona, and for her role as a class leader, like, Rachel plays a vital role. Is that true? Yes, always. Yes. Thank you so much for, being such a help for Fiona. Thank you for joining this team. And where is Leon? Okay, so Leon is, Leon Wright is our graduating student. And Leon, there is no class goes without Leon asking question. And Leon comes with so many different ideas. And she, always she wants to talk, and she wants to engage in a conversation. And we need a student with a variety of learning styles, and everybody have a different learning style. And then we still have a common classroom. That's about, the learning experience as a whole. And I am so happy that Leon joined in this discussion, so we can share all our experiences and the best practices. And I'm really excited to see the discussion coming. Thank you so much.
Thank you, Dr. Christiana, for that nice introduction of your faculty members and the students. And to introduce myself, I am Dr. Lata Venkatesan. Currently, I'm working as the professor cum principal. And we have a group of students from India. Now, may I request them to self-introduce themselves? Shall we start from Yasmin, who is the president of SNA?
Hello everyone, good morning and good evening. So I'm Yasmin, and as ma'am said, I'm the president of Student Nurses Association in this institution. So I'm very happy and very excited about this discussion, and I'd like to thank ma'am Dr. Lata for giving me this opportunity to be a part of this discussion. Thank you so much, ma'am.
Thank you. Now may I request Manjeet, the Secretary of SNA.
Namaste, this is Manjeet. I used to be the ex-General Secretary for SNA 2020, and I'm very happy for this international collaboration. Thank you.
Yes, thank you. Now, Dipamala, our MSc Nursing student, is there. Dipamala, can you introduce yourself?
Hello, good evening everyone. Good evening and good morning everyone. My name is Dipamala. Right now I'm pursuing my MSN in neuroscience, and I'll be thankful to the Dr. Lata and Christina for this opportunity, and I'm looking forward for the session. Thank you.
Thank you. Now, Lima. Lima, can you introduce yourself?
Hello everyone, my name is Lima Rothpol, and I'm currently a third year undergraduate student, and I am so grateful to be a part of this interactive section, and I hope that this session will be beneficial for all of us. And I thank Principal Ma'am for giving me the opportunity to be a part of this, and thank you so much.
Yeah, Asmeet Kaur, please.
Hello everyone there. I'm Ashmeet Kaur. I'm doing my post-basic BSc from College of Nursing, Delhi. And I would like to thank ma'am for giving me this opportunity. Thank you, ma'am.
Yes. Fretti, can you introduce?
Hello everyone, I'm Fretti M. Paul, and I'm currently pursuing my second year undergraduate under New Delhi. Thank you.
Yeah, Ritu. Ritu.
Hello everyone, respected faculty members. So myself Ritu from final year student, undergraduate student. So I am very happy to be a part of this discussion and looking forward for more discussion in future. Thank you, Dr. Lata ma'am, for such a good initiative. Thank you.
Yes, yeah. Sneha, please.
Good evening, everyone, and good morning. I'm Sneha. I'm pursuing my second year in BSN. Really looking forward to this session. Hope it's going to be, I know it's going to be beneficial. Really looking forward to it. Thank you.
Thank you. Taruna, please.
Good morning, everyone, and good evening to the present there in USA. So myself, Taruna. I am second year BSc Honors Nursing student. I am very happy to be here, and I want to thank Dr. Lata ma'am and Dr. Christiana ma'am for giving me this opportunity. Thank you.
Okay, so the first question will be student with Fiona, and then it will be answered by Sneha and Fretti.
All right, so for our first questions, what we have here is nursing as a global professional, right? So how we can prepare the nurses to provide culturally sensitive care to patients or family. So.
Thank you, Mrs. Fiona. So I would like to share a few points regarding this question. So as Mrs. Fiona stated, nursing is a global profession. So several nurses has migrated from one country to another country for providing healthcare. So for a nurse in a different country, totally different country, they will face several limitations, including that of linguistic as well as cultural barriers. So an international nurse working in a totally different hospital setup, they should be aware of the healthcare delivery system there in that country, because healthcare delivery system is like totally different in different countries. Stating with a simple example, end of life care in India and USA is like totally different. Also, the nursing care practice is also entirely different. Also, a nurse working in a different country, he or she will face several ethnic or culturally diverse group of patients that they have never ever dealt with. So for me, I feel that an efficient training program must be implemented for this international nurses, and these training programs should be in such a way that it should provide information about the healthcare delivery system in that country, as well as several nursing care practices practiced in that hospital setup. Also, they should provide information about the cultural load of cultural patient load, different culture patient load that a nurse, as a nurse, he or she will be dealing with. Also, the do's and don'ts associated with different cultures. Also, if interactive session with the senior nurses is kept, it will be much more efficient to improve the cultural sensitive care or patient sensitive care. So I think these are the points that should be stressed upon. Thank you.
Hello, everyone. I'm Sneha. So I'd like to add a few more to what Preeti said. So as she said, nursing is a global profession. And like as far as an international nurse is concerned, I guess the main barrier here is language barrier. So as you all know, for the nurse-patient relationships to be effective, communication is very important. So it covers both verbal as well as non-verbal communication. So right now, in many institutions, we do have implemented programs that roll out all these linguistic barriers. So like for me, I think most commonly, like what we can use is like everyone has a mobile with them. So the easiest and I guess the most convenient one would be Google Translator. When other services are not accessible, people can go with Google Translators. Also, certain institutions, they've hired professional translators for serving this purpose. And as an undergraduate nursing student, I strongly I think that all this, like the education and training and the skills that are required for meeting all these issues should be included. Like the training should start at the student level itself. like the students, they should be addressed about the various health concerns, the disease, like the different diseases, the cultures and beliefs, then what are the healthcare delivery systems that are available in different countries, so that when after completing their education, when they migrate from their own country to the other, they can easily, adapt, and they can provide the best possible patient care. So to me, like all this should be included in the curriculum level itself. So thank you.
Yeah, thank you, Freddie and Sneha. Very valid points you have spoken. Nursing is a global profession, really true, especially for Indian nurses. You will find Indian nurses working in any given country in the world. But when the students or the graduates, when they go to a different country, they must be facing very many challenges. They should know the nursing care delivery systems of that particular country, the culture of that particular country, and they have to make several adaptations. So now the concept of global university and globalizing education is spoken by the premier leaders in the field of education in India. Not only for nursing, even in other fields, they want to introduce global education, where they want to open up opportunities for the students from many countries to come to India and learn. So that way we have to really prepare the curriculum to meet the requirements of global nursing students entering into the profession. So when we globalize the nursing education, then the nurses will be able to accommodate themselves and adjust themselves in whichever country they are working, and they will be able to deliver the best possible nursing care. And we also need to share our best practices, part of this globalizing nursing profession. Each country and each hospital, each institution will have their own best practices. But we need to popularize our best practices. We need to publish our best practices. We need to have more focus group discussions like this between the professionals across the world. So we will amalgamate the ideas and we will be able to make our profession practice all the best practices available. So these are all some of the ideas which I have to make nursing as a global profession. We have to be truly integrating all the concepts of global health, all the best practices in different parts of the world, and we must be united together, and we should have networking between the nursing professionals. And COVID has given us the opportunity. It has broken the boundaries, and now we can get connected with anyone over a Zoom call or over a Google Meet. We can discuss, and this is the advantage which COVID has given us to interact with many people in various countries. Thank you so much.
Thank you, Dr. Lata. So let's move on to the next question. The next question is will be asked by Manjeet and Ritu, and it'll be answered by Joseph and Roger, and the moderator is Dr. Dela Cruz.
So hello everyone. So I want to have a more kind of vision for future nursing as in digital transformation in healthcare over the years. So I want to ask how nurses can lead the e-healthcare services and how they are maintaining the records like electronic records and documentation. Also want to highlight the points of artificial intelligence and how the use of data analysis can be used as future of nursing. Thank you. So anyone want to discuss about it?
Yes, Joseph and Roger will be leading the discussion.
Yes, thank you, Ritu, for that question. Namaste, everybody. My name is Joseph. I'm a student from Los Angeles. And with digital transformation, so the beautiful thing about the modern world is we get to involve the patient in their care, like from the comfort of their home. So digital transformation for me, the way I see it is it allows easy access for sharing pertinent and credible information that patients are able to use to guide their care at home and prevent readmission, because that's the goal in nursing, right? Like we want these patients to get better and not be readmitted. So I was doing some research and found out that in the United States, we actually use a platform called Patient Education Genius, or PEG for short. It's a platform developed by a Michigan-based healthcare technology company called Coherent RX. And this basically allows physicians to upload their educational healthcare links, videos, documents, and images on the platform, and they can send that to the patient, which then the patient can share, which then the patient can view. And the beautiful thing about this is these are not just random links you get from Google. Like, I'm not trying to diss on Google, but like these are actually credible videos, relevant, peer-reviewed content that's easier for the patient to understand. And when you send it to them, it'll launch from their patient record and they get to select whatever they want to send to them. And then the doctor can actually see if the patient opened the link that's been sent. And if they haven't opened it, the doctor can be like, hey, you need to check your the link that I sent you because this is going to be beneficial. So again, like it forces people to look at their condition, what they can do to better themselves. So again, the goal is to prevent readmission. And all in all, basically just digital transformation promotes easy access for patients, which is amazing. I don't know if Roger would like to expand on that.
Yes, I would like to expand on that. So good evening, my fellow Los Angelinos, and namaste to my Indian friends. My name is Roger. I'm a 4th semester student. And to talk about artificial nursing. So related to the use of big data and the use of artificial intelligence, or AI for short, I need to explain what AI is, right? So according to the New York Times, quote unquote, AI encompasses the techniques used to teach computers to learn, reason, perceive, communicate, and make decisions similar to or better than humans. In layman's terms, AI refers to the simulation of human intelligence in machines. So how can we use AI for nursing? Well, for example, biomedical engineers at UCLA created something called Super Alarm. One word, Super Alarm, back in 2014. They published their patent around 2018, and I think they're starting out right now to the product itself starting to be used in ICU settings. So, but back to the topic, a Super Alarm basically combines raw data from like EKG monitors, IV pumps, or any kind of monitors used in the ICU setting, along with raw data from the electronic health records, say your physician notes, nursing notes, your X-ray labs, prescription drugs, etc. And so with these different kinds of data combined, the Super Alarm helps to predict patient deterioration, such as code blue events, which is something that occurs more often in the ICU. And one more thing to add is that also in the ICU, bedside ICU nurses often experience something called alarm fatigue. This is when an ICU nurse is exposed to a large and like a lot of annoying number of frequent false alarms, such as those EKG monitors or any kind of monitor I just said before. So basically anything that beeps, right? Mind you, most of these false alarms are false alarms. So the ICU nurse would be desensitized to these alarms, which is problematic because if it is a real alarm, like an actual emergency, a real beep would be ignored because of that desensitization. So with the help of the Super Alarm, which basically combines all of these machines into one beep, it can help combat alarm fatigue. Instead of, say 8 beeps all beeping all at the same time in the ICU. And mind you, this is just one example of use of the AI in a hospital. There's multiple ways to use AI in medicine and nursing. And eventually this will change healthcare for the better in the future.
Very good points from the Angelinos, Joseph, and Roger. Over the years, we've experienced and have seen the evolution of electronic health record. But bottom line is, of course, with the advancement of the technology, it's good for us to work with these systems because everything is auto-populated, like from preventative, even curative approach in the healthcare system. We always have to treat our patients as a priority and treat them as humans, because like priority is like we just don't treat those numbers, but despite all this advancement, we have to always like look for the welfare of our patients. And one good thing about this digital transformation, I myself, I have elderly parents. So with COVID and all that, they're advising for us just to conduct like an online checkup for them. And it's advantageous because like all of those things are already prepared for in the system. And then they get to update. And of course, my parents are secured in catching like all of these unwanted, germs or viruses, as opposed to going to those clinics. But one good thing about our health records in the United States is that we are really high on observing the HIPAA, Health Insurance Portability and Accountability Act. Because one violation from any of those electronic health records or misuse by a staff, they will be penalized. So that's the advantage of it.
Yes. Thank you. It's a very good discussion. Yes, HIPAA is very big, and we really want to secure the information, patient information. Thank you so much. So let's move on to the next question. Okay, so this is, okay, the next question will be asked by Roger, and then will be answered by Taruna and Lima, and Dr. Lata Venkatesan is the moderator.
Okay, hello again, guys. So on to the next question or topic, which is about ways to break gender and racial stereotypes in nursing. So how would a nurse respond to or break stereotypes on how nursing is conceived as a female job only, or how nurses are just a doctor's assistant to someone who might have a preconceived notion of nurses, probably due to portrayal of nurses from media, such as TV shows or movies?
Hello, everyone. I am Lima Rosebol, and I would like to speak regarding the stereotypes in nursing profession. So as Roger said, there are many stereotypes existing in our nursing profession, and these will definitely distract the nurses from their vital role in their healthcare. And I think one of the main reasons for this is the lack of awareness of the public. So according to me, some of the measures to break these stereotypes are I think with the help of mass media and other mentorship programs or campaigns, we must raise the awareness of the public about the various roles and opportunities in nursing profession. And also we must encourage nurses to take their master's degree or PhD so that they can take up the leadership roles and work alongside with nurses. And the two basic concepts in any profession are the job responsibility and the job authority. But unfortunately, in our nursing profession, the job authority accounts for only 10 to 20%. Despite working on the front line of healthcare, the nurses are not being consulted, and the nurses are not asked for their opinions. They're not allowed to take any decisions for whom they care for. So I think if the nurses are given the authority, it will lead to professional autonomy and higher patient satisfaction. And I think more men will be attracted towards nursing if they are given the autonomy to function. And also I have seen in many nursing colleges, the admission to nursing programs are restricted only to the female candidates. So in that case, I think every student, irrespective of their gender, should have the right to apply for these courses. So I hope these measures will help in mitigating some of the stereotypes existing in nursing profession. Thank you so much.
I would like to add a bit more to this. I think institution-based care is also a stereotype nowadays. Therefore, we should promote home-based care, which will eventually enhance the healthcare in different ways. It will provide us with safety, comfort, and convenience. It will help the patient to recover faster with a fewer complications. Since the environment and the comfort of home will always be convenient for a patient until the situations are not very critical. Also, it will provide us high quality care to the patient. Home health care is grounded in evidence-based practices, which make sure that the patient receive right care at the right time in their home. So, we will providing the patients with a personalized care. The patient will receive one-on-one personal attention and a care plan to fulfill their specific needs. So, to conclude, home health care is a beneficial choice which is safe and affordable that will ultimately help the patient to avoid unnecessary visit to the hospital. Thank you.
Yeah. Thank you, students. I think it was a very nice discussion. And this point was brought out by Joseph, that we have a lot of stereotypes in nursing and we should think of breaking the stereotypes in nursing. Yes, that I really liked that question when we had the preliminary discussion. There are a lot of stereotypes. We are attached to the old practices, or we are comfortable to practice the way we are practicing. But we need to think, how can we improve upon, how can we modify, and how can we also scale ourselves along with other professions, how they are progressing. We need to have a kind of interprofessional education. We need to understand what we can gain from the other professions, especially from the technology, especially from the engineering knowledge, because nursing, we require to modify our procedures. We have to incorporate technology into our procedures. Like if you see the way how we used to check the temperature of the patients. Earlier, we used to use the thermometer. It was mercury thermometer, and now it is digital thermometer. Now, gone are the days, there are fever scanners where you will just attach a strip on the patient's body, and it will automatically give signals to the system in the station. If the temperature is either hypothermic or hyperthermic, the alarms will come, then the nurse will intervene. It is not necessary that we have to keep on checking the temperature going at the bedside and personally using an equipment to monitor the temperature. It is not necessary. This is one example I am telling. The technology is helping us to reduce our workload and to be more specific, more precise, and more without much variation to provide care. So I feel we have to come out of the mindset, and every day or every time we need to think, how can we modify our practice? How can we improve further upon? And we need to talk to the patients, what is their expectation, and patient related outcome measures can be kept as an indicator to measure the satisfaction of nursing care among the patients. And as you all said, that men in nursing is an issue which is debated over many years. So gender equality and the kind of shifting the care from institutional based care is also need of the hour now due to COVID, especially now. There are shortage of beds in the hospitals because of the increasing number of pandemic cases. So we have to promote home-based care. We have to use the technology for this. Many nurses are today doing telenursing. They are guiding and monitoring the patients who are under quarantine in their own home settings. So this is how we are breaking the stereotyped practice of nursing, and we are venturing into the newer models or methods of delivering nursing care. So let us also think in this line, what are all the other stereotypes in nursing, and how can we come out of the stereotypes and be open-minded and innovative and creative in designing the way we are going to give care to the patient population. Thank you.
Yeah, thank you so much for the wonderful discussion. I just want to add one point here. In US, we have the home health care. That's a very well-established care here, the home health. When the patients need home health, when they discharge, all the arrangement has been made for all the different services the patient need at home. So that's one thing. And in COVID, even the primary care physician, like, our own doctors, for a long time, they were doing, whatever, Zoom visit and all that. So those things were also done, like nurses and the doctors. We did not go to the doctor's office, but they kind of provided care via Zoom or through virtually. So I just want to add that. So,
but I also would like to add here, we need to incorporate this concept in nursing education itself. When we are educating the students, we are giving them the mindset that they are going to be involved in institutions. They will be providing institutionalized care. Though we have community health nursing as a subject, they go for home visit and come. We do not take the ownership for entire care, So I think we need to bring in this concept that it is not only institutionalized care. They can work in different settings like schools and industries and the other public health units. So this concept has to be strengthened. Nursing is not only institutionalized care. We need to go beyond institutions and provide care to the patient population.
Right. Yes, that has to be, more emphasis should be given for all the care setting. Yes. So yes. So the student will be asking is Fiona, and then the student will be answering is Deepomala and Yasmin. And either Dr. Lata or myself will be moderating this.
Yeah.
Okay. So the next questions, what we have right here, right? It's about bottom to top approach, promote nurses at all levels to contribute for leading. So my questions is, will student nurse hear the call, or what faculty can do to motivate students to become a leader? So.
Okay. Hi Fiona and hello everyone. I'm Yasmin and I'm very delighted to answer this question. Bottom to top approach, promoting nurses at all levels to contribute in leadership. So what is the need of this? Actually, as we all know that nurses, they are the pillars of healthcare system and they are responsible for promoting the well-being of the people all over the world. And for that, nurses should be effective leaders and they should have great leadership and managerial skills. So nurses must have to be effective leaders who can maintain a balance between patient care, working with the fellow nurses, nursing staff, supervisor, and even the healthcare facility administrator. So in order to achieve this, the following steps, which I feel can be taken. Student nurses should be nurtured into effective leaders from the beginning. I mean that it should be involved in their curriculum only. They should be given opportunities to enhance their leadership skills by giving a chance for organizing activities, for giving them a chance of decision making. So things like that should be done. Another thing is, another point I would like to add is that there should be involvement of nurses in the decision making as well as the policy making. Another point I would like to say is that communication is a very important thing. So by enhancing the communication between the middle level and the top level managers and developing the communication skills in nurses and the nursing students as well, we can develop this leadership skills in nurses. So that's all. Now I would like to request Deepomala ma'am. Ma'am, please add some points. Over to you, ma'am.
Thank you. Thank you, Fiona, for your questions. And Yasmin, I agree with you. You have a great point. But what I would like to highlight here is when we talk about the bottom to top approach, it's not only about the student and the faculty. Yes, it should be started from the student period, but it should be from the bottom to the top approach, including all the level of nurses. So here, I would like to highlight some point. Initially, it was right that it should be started from the student leadership. The quality of the leadership, the managerial skills should be initiated since the graduation level when they enter to the college or the school. So like a lot of practical stuff like symposium, panel discussion, practice teaching, all they should be initiated since the beginning so that the quality will retain and maintain in student. Then second point I would like to highlight is here we should start for the promotion for the higher study. Some nurses we see that those who are very higher, those students who are those nurses who have a higher degree, example like those who have MSN, PhD, what they do is they try to shift from the clinical setting to the education sector. If you see any PhD, they won't stay much in the clinical sector, rather they will go to the education sector. So what I say is we should provide more facilities and programs should be given so that we can retain all this higher educated nurse in the clinical setting so that in the decision making of any policies or any rules and regulation, then it will be very feasible for everyone. And the last point what I say is if we include all the level of nurses, example, leaders of grade 2 nurses or nursing officer, top level manager, middle level manager, while taking any decision, if we include each and everyone, then it will be, our profession will be in great hand for the futures of our nursing. These are my some points that I would like to highlight. Thank you, everyone.
Okay, thank you for the great points. Yes, so it's not only in the nursing program, also in the practice side. So, you know, the bottom to top approach, when a new grad nurse join, okay, so it is also we expect, or, you know, we need to develop that culture that experienced nurses groom these new nurses so that they get the confidence and then they will reach to the level of very seasoned RN. So that needs to happen, not in the nursing school, in the practice side, when these student nurse graduated and then join in the nursing workforce, that should be the nurse has to be supported all along, and she should feel welcomed. She should learn from the experience, or she has to shadow with the experience RN. So all the nurses have to consider grooming the new nurses so that we have a very strong workforce, because we need such a strong workforce. We are facing so many health crises, right? So we need these experienced nurses or the new nurses join in the force so that we have a strong nursing workforce. Okay, that's one thing. Also in the new, yes, go ahead.
Here, it's not only starting with the students, especially when they are employed, when there are major policy decisions taken with regard to nursing, then the voices of all the nurses should be heard. So we should have the mechanism, the portal, where all can contribute towards shaping nursing, But usually, if you see, it will be the top to bottom approach. Some decisions will be taken by the top level officials, and it will be communicated to all the levels of nurses, irrespective of understanding whether they will be able to implement it, what practical problems they will issue, what percentage of nurses will feel comfortable with the decision. Those kind of approach is lacking in nursing. So we need to have the mechanism or the portals where the nurses will be given opportunity to express themselves freely, post their ideas, because only those who are working at the ground level will know the difficulties of the patients, will know the difficulties of their colleagues, and they will be able to give better suggestions. How can we modify the system? But usually they are not given opportunity to express themselves. So, but now the scenarios are changing. There are opinions from the bottom level is being taken up. So that is what I feel, that every nurse, irrespective of her designation, irrespective of the area she is working, she must be given the freedom of expression to express her opinions, her thoughts in an innovative manner. What I say is not for aggressively fighting, assertively to put forth their ideas. There must be portals and mechanisms to utilize their wisdom.
Yes.
Thank you.
Very much. So in the policy making, there should be room, or even that a policy has to be revised, that there is room for inclusion for all this, representation from all levels of nurses. Okay, so from student nurse, newly graduated, and then newly entered in the profession. Also, mid-level nurses, like, those who are experienced like 10 years or 20 years, for at every level, there should be representation so that the concern of all these different nurses can be addressed, and they can put forth those things in the policy. And then they can also make an agent in the policy making. Okay, so those are the points we want to include. So anything else, any more discussion on this topic?
We can move on to the next area of discussion.
Okay. Okay, so the next discussion is specialization in nursing. So this question will be asked by Asmit and Yasmin, and the student answers will be Rachel and Leanne. And I'll be moderating that. Okay.
So as Lata ma'am has already mentioned, that caring of the patient is not only consist to bedside only nowadays. It also include community health nurse, school health nurse, occupational health nurse. So my question is, what are the areas of specialization in nurse that we still need to develop, that we still need to focus on?
I think there should be a stronger focus on the nurse practitioner role. The nurse practitioner role started in the 1950s, but has flourished since the 2000s. It flourished because there was a shortage in physicians, and they filled that role because they look at the patient as a holistic, or look at the whole patient. They focus on preventative care and health maintenance rather than just the disease. When an NP role is brought in, or the NP model is brought into the healthcare system, the costs are decreased, the RTO, or the return on investments, are increased, and the readmission rates are decreased. So they provide the same amount of healthcare, or they can work independently just as physicians. They may not be able to prescribe the same medications, but they are still able to diagnose and interpret data just as physicians do. So I think we need to just improve or expand their specializations in geriatric, family, and pediatric care without all the barriers that they experience. Leanne, do you have anything else to add?
I always have more to add. Yes, within the specializations, I feel like this area is so encompassing of almost all the things that we've already discussed, because there's the stereotypes that, sometimes people say they want the doctor to do a certain treatment or procedure, but actually the nurses are more well-trained and familiar with doing that procedure, but there's some kind of a stigma that patients are unaware of actually the expertise level that many nurses have. And some nurses are able to put a PICC line if they're trained in radiology. There's the school nurse, as you were talking about before. Some school nurses actually take on the community health role and have kind of like a clinic for families as well that they can be taking care of the students. There's the like the postmaster's degrees in certified registered nurse anesthetist. There's the clinical nurse specialist, all the NP different areas of specialty. There's the critical care registered nurse, different kinds of certifications that you can do, the PICC line that I also mentioned before, dialysis, nurse midwife. There are so many various types of nurses. And then the specialty like emergency department, like Dr. Dela Cruz, and oncology, NICU, telehealth, as we were talking about before, wound care is very specialized. Something to look forward to and to put out there as a possibility of what expansion can happen is intubation. The nurses are with the patients, and if they, paramedics are able to do intubation as an emergency procedure, but when the nurse is there, it could be, minutes are precious in airway, compromise. So it can be super effective care, save lives, save money, as Rachel was already saying. I was reading in an article that when the NP model was incorporated into the healthcare, it saved 1,600% in costs, which is huge. That's the return on investment that she was talking about. It's, it was a neuroscience, one of the Indian nurses, she's doing the neuroscience, I heard her say earlier, and that's, it's a wonderful specialization to have. There are so many nurses, and obviously you have to be a bright individual to go into this. And usually we're people who, care and have patient care as a high standard. So to have those kinds of values and standards incorporated into various specialties can only increase the quality and efficacy of patient care in the future.
Thank you. Yes. We had our discussion, and nurses are branched out into every area, like flight nursing, right? Flight nursing. Yes, we need, and then there are various nurses. And then the very important discussion is when what is this, EMT, the technician, medical technician, or emergency medical technician, if they could intubate the patient, why not nurses with all the education we have gone through for the 4 years or whatever number of years? Why not? I know the nurse anesthetists, they have the scope of practice, they can intubate, but even nurses who are interested in intubation, you can really save time. As Leon and Rachel mentioned, you can save time in saving patient, right? Airway, breathing, very important. And now, even with this COVID, it makes more sense because nurses have gone through the education, and definitely we have gone through more than, it's not undermining any profession, but we have that education. We can definitely learn that skill, right? And then, nurse anesthetists, of course, they have, but even regular nurses, we can have that as a specialty. And what else you can think, like, different specialty. Right now, we have so many specialty, like dialysis nurse, PICU nurse, right? PICC line specialist, and there are so many areas. And, if anything else, anybody want to contribute on this? And also the other one, right? One more point I want to bring in US, they want to, have BSN as a minimum qualification to become a bedside nursing. Okay, so that is, but they're still in the process of implementing it. So many hurdles have come, but that's the goal. Goal is to have at least a nurse with the BSN degree to be at the bedside. But it's going to take still more time to achieve that. And again, the nurses certification, like a med-surg certification, critical care certification, even the nurses with the associate degree, BSN degree, they go into specialization. So these things. Dr. Lata, you want to contribute anything on this?
I think Dr. Dela Cruz will be able to.
Yes, Dr. Dela Cruz. Come on, Dr. Dela Cruz.
Yes, for professional advancement, it would be good to start from the basic, because again, we cannot go advanced if we do not know the basic. So once we finish with our BSN, go for our acute nursing experience, it would be good to consider like going for your master's and postgraduate programs. But along that line, here in the United States, we are offering like what the students and Professor Dr. Bhaskaran had mentioned earlier, that we are high into these certifications and specializations, but you have to go to extensive training for you to be qualified. So in the emergency department alone, for us to work in a trauma center, you need to undergo trainings like trauma nursing core course and then ENTC for pediatrics. So that's going to be like every 2 years and every 4 years, we need to recertify.
Yes, and one more point, this acute care nurse practitioner. So in the advanced nurse practitioner, in that one is nurse practitioner role, the other one is clinical nurse specialist, the CNS. That's a big, okay, in every floor, like critical care areas, emergency, there are clinical nurse specialists. They have specialized in that area and they'll be in the hospital. The nurse practitioners, of course, they can independently practice in the doctor's clinic or they can have their own clinic. So this division of nursing is come under this advanced nurse practicing, okay? And apart from that, we have the nurse anesthetist and the other areas, okay? I think we kind of pretty much covered in this area. So let's move on to the next one.
I always feel transplant nursing, and robotic nursing, and these are all the areas we have to think of part of the specialization. School health nursing. We need to have a curriculum and prepare nurses to work as school health nurses so that we can groom the children right from small age with the appropriate habits and with great consciousness on health,
Yeah, so one thing, because you mentioned the school health, I just wanted to say, in US, every school has got a school health nurse. That's really a big area. They are hiring in the Los Angeles community called, what is this, LAUSD, Los Angeles Unified School District. Almost every school has got a school nurse, and that's really big in US. Okay, so let's move on to the next question.
I wanted to add about that, about the school nurse, they also have to go get a certification.
Correct.
So, yeah.
Yes. Okay, thank you. So let's move on to the next question. The next question will be asked by Rachel, and it will be answered by Manjeet and Ritu. Okay, and I'll be moderating this, and Dr. De La Cruz and Dr. Lata will be sharing their experience too.
All right, so as the slide says, I was really wondering, as nurses, how do we successfully implement evidence-based training or evidence-based practice in nursing?
Okay, thank you, Rachel. Hi, everyone. I'm Manjeet, and I'll be more than happy to answer this question. Talking about evidence-based practice, this is a very integral part of nursing care. So in order to maintain this as a part of routine nursing care, we need to educate our RNs so that they get used to it. They get used to implement these practices in their routine care. Also, we can promote them to perform various evidence-based researches. For that, we need to also convince our organizations to provide us with various intramural funding so that these researches can be completed and they can be used in time. The other thing I want to mention is that these evidence-based practices, they should be made part of the nursing curriculum. I mean, the nursing students should be taught that how to utilize these findings, how to conduct these researches, plus how to communicate these findings and how to prepare critical analysis and all other various aspects of researches. Also, it should not be confined to the number of research classes or to the theoretical part. They should be integrated into the practical part as well. In addition to this, I want to mention that in India or maybe in US also, the healthcare, like the nurses are overburdened with a lot of patient care. And in order to meet the requirements of the patient care, they tend to forget. There is this natural tendency that in order to complete their work, they'll forget the standard practices. So we need to maintain the standard RN to patient ratio so that we are able to achieve things in time and with utmost reliability and credibility. The last I want to mention is that the RNs, they should have in-service education programs on how evidence practices constantly support them throughout their nursing career, and they will be able to use these findings, and ultimately it is for the patient safety, and this in turn will get various positive results. Anybody would like to add something to it?
So
Yes,
thank
Ritu. Yes, go ahead, Ritu.
Yeah, thank you, Manjeet, for addressing some points related to the evidence-based practice. So I would like also add some points in this regards that changes in nursing care are inevitable, and ideally it should be there to provide the competent nursing care to the patients. So we need to upgrade the evidence-based researches as a part of nursing care. In addition to that, we are also available with lot of literature review related to any of the research, like maybe in US or India or throughout the world. We are available with lot of literature review, but it's also important to have a safe and reliable knowledge related to that subject. So we need to change our focus from the systematic review to the randomized trials, so that we can time to time we need to upgrade the research practices all over the world. Also, I would like to add that the nurses who are working in the clinical and who are confident, sure about their best practices, they should need to get their researches published, so that they can be easily accessible to everyone. So that's from my side.
Okay, thank you. Thank you so much for bringing up all these points. That's very good. In US, I just want to say that almost every hospital, major hospitals, some of the hospitals are magnet hospitals. For that, they have to go through a series of standards in order to get that certification. But almost all these hospitals have a research unit. Okay, so they constantly do the research. And then because all about the evidence-based practices, the practice is being changed based on the research finding, and it is through scientific approach. You can't just simply change the way we practice. So it is based on sound research, and with whatever the outcome coming out of this evidence-based research, the practice is changed. Okay, so almost this major hospital have this research unit, and constant research is going on. Oh, Dr. De La Cruz, you want to contribute on this? You have the expertise here. You're on mute.
I think you guys have said it all, so we'll go with that.
Okay, Dr. Lata, you want to say anything here?
Yes, I think we need to create awareness among the nurses. If they are asked to change the way they practice on one fine day, they should learn to question what is the level of evidence and why should they change. They should look for the level of evidence and accept for the changes. That kind of awareness need to be created. And the nursing leaders have to attach the level of evidence to every area of practice. Is it out of our experience, or is it out of observation, or is it because of the cohort studies, or is it based on systematic review? When we are presenting our interventions, even in the conferences, when we present our best practices, we have to attach the level of evidence. So when we reach that level, I think evidence-based practice will percolate the practice area. But now the current concept is moved from evidence-based practice to evidence-informed practice. The evidence-informed practice is how popular is the idea, where it is published. Is it published in the conferences, or it is published in journals, or is it out of the experience? What is the level of evidence information? That is the current concept which is being used. So we have to create a kind of awareness among nurses to promote evidence-informed practice.
Yes,
thank you.
Yes, thank you. I also want to say that in order for all of this to happen, the nurses has to be assertive. You can't just simply do just because it is existing for so many years doesn't mean that you have to continue that. Okay, if you really see that this is not working, you have to be assertive. You have to be, willing to go through the change. So the change has to happen for, the policymakers or the researchers and also the nurses, everybody put together to bring a solid practice, right? Okay, yes, go ahead.
Dr. Bhaskaran and everyone, I would just like to share one thing, and this is global, but we put highlight on this practice of sepsis. Over the years, when they started sepsis, like we created councils, but purely evidence-based, like they keep on changing certain parameters. But over the years, what's the beauty of having research and how involved should we as nurses as part of that study? So they've conducted several studies on sepsis. Of course, they've done so many phase validity. And then they found out that, for us to meet serious criteria, this is all that we have to do. These are the things that we need to meet in order, and this will be the approach on how we will be treating our patients. But that serious criteria is actually the fruit of research wherein nurses were highly involved. And now at least like sepsis are well managed. It's a standard practice all across the United States. And we are getting like good response, and that is purely evidence-based. And as nurses also, the beauty of being involved is that, like what Dr. Bhaskaran and Dr. Lata had mentioned earlier, that we need to be assertive, because like if these parameters don't work, even though it's evidence-based, it really needs to make sense to us as practitioners. So
yes,
all right. If it doesn't make sense, then there's no point in having that. Yes.
Yes.
So yes, and the nurses have to be willing to go through the change, and it's every level we need this change. Next question is Joseph and Sneha. Answer will be done by Leanne and Fiona, and I'll be moderating that.
Hey, hello everybody again. So with the continuous rise in COVID cases in both America and India, hands-on experience has become limited. So through a student's point of view, I would like to know what are some innovative ways can you suggest when it comes to teaching and or maximizing our learning experience? Like what changes do you want to see in your learning experience?
Okay, I would like to express some of my views on this. Like in this pandemic, many of the students are not able to go to the clinical areas. They are not having that interactive session with the patients. So what we can add is, one is the flipped classroom, and second one can be the patient as educator. In the flipped classroom, what happens? The student can learn the theory part at their home, and they can practice the live problem solving process in the classrooms. And as a patient as educator, we can bring the patients to the classroom via online mode instead of sending the students to the patient side, so that they can interact and they can study well. Now, I would like to request Leanne to add some more points.
Thank you. In light of that, people learn in different styles, right? Some people are visual learners, some are audio learners, some are kinesthetic learners, and losing the kinesthetic for everybody, even if that's not necessarily your style, is a very unfortunate thing that us nursing students have had to go through during COVID. So something that we can do to try and help during this time and also in the future is to have more challenging role play dramatizations with the student and faculty, and the faculty acting as the patient, because they have the most experience in these different, kinds of situations, and they can, kind of guide us in, how they would respond, and then kind of put us on the spot for critical thinking exercises of how to handle, different situations that you may not come across until you're actually a nurse. Right? You have limited experience as a student. And so just trying to have as much of an experience as possible in the classroom is helpful. And then also having patients come in as guest speakers that can share their experiences that they've had in the hospital, so that you can get, the firsthand account of what happened for them, legally being able to, clear that so that they can come and talk and feel, safe about sharing their story. And then also like what went well, what went wrong, and just kind of ways to, affect your practice later that you may not have, it may not be in the textbook, right? It could be something that is, an innovative way to introduce, as we were saying before, like the student's voice from the bottom into policy so that, more positive experiences and outcomes can happen for the patients. There's all kinds of resources. In our first semester, I had Dr. De La Cruz as my clinical instructor, and she let us go to the ICU to hear the rounds, and the doctors and the nurses and the pharmacists and the dietitian, and everybody was there. And so we got to have a really kind of clear picture about what was happening and what was the plan of care for that day. And it was super helpful, as a nursing student, that's not something that you're gonna see usually. So to be included in that area was very informative and real life, an actual real life situation, And then we have our skills lab where we have mannequins that are like high fidelity simulators. So, the dummies that are laying in the beds is like pregnant or, the baby, and you can, adjust the heart rate to test students of like, what's the heart rate, right? So 140, 150, like where is it? They can adjust it. There's online resources that we have, our ATI program that we, there are video case studies in there, and there are some of them that you can kind of like choose your own adventure. And if you choose this option, these are the things that are going to happen. So if you choose wrong, it's like your patient's like getting worse, right? But if you choose right, your patient like gets better and gets discharged. And so there's different ways to, and even just to see, like, well, I'm going to choose wrong just to see where does this go, right? Because it's always, an advantage to learn from your mistakes, especially if it's on a computer rather than a person. But then there's also like virtual simulations, different kind of health assessments, and real life ATI. There's the iHuman by Kaplan, different like concept mapping, going through that with instructors in the class to just kind of get a better idea of the overall picture before you're seeing the actual patients in clinic. And then there's obviously now we've got teleteaching, right? Like everybody's on Zoom for the most part, and different multimedia experiences. During my PEDS rotation, that was right when COVID shut us down and we were kicked out of having any kind of like patient care by the community college district. And so we did PEDS simulations that were online. That was really helpful. And, you got to same kind of thing, like choose your own adventure. I say choose your own adventure because that's an old like way of reading that there were books, So anyway, there's gamification also. So this Generation Z, the people that are the younger ones, they are learning in a whole other way because they grew up on computers. I was born in 77, and so I've adapted along the way, but this younger generation of nurses are, they have different, I guess probably even synapses that are like taking effect. They're really quick with all the technology. So kind of tailoring it to their best capability is only going to help to, improve their own like clinical reasoning and decision making in a realistic and secure kind of way that's safe, but that is fun, in a game. So it could increase the satisfaction, creative thinking, control, and other aspects that the students, are having, and have really like decreased little to no negative effects. It's only going to help to have a significant impact on their decision making as nurses and eventually nurse practitioners,
Yes. Thank you so much for, bringing all this. Yes. So you touched almost many areas. Right now, Generation Z that's a new generation, okay? They born with gadgets, right? Like, from the birth, they are just used to the phone, and then, so the learning, the teaching, the nursing also the nursing teaching has to change accordingly, okay? Generation Z is a total different type of learners. So that's why AI has got a very big role in this teaching these students, definitely. Okay, the other one I want to point out, in the mental health, there is 7 cups. Like the student nurse can interview real patients, right? That's one of the sites, 7 cups. So pretty much you guys touched on it. The second topic on that question, yes, Fiona. Go ahead.
Yeah, so can I ask the question? So we all know cross-cultural learning is very important. So, but still there are some limitations to it. So what are the ways in which we can improve or overcome such limitations?
Thank you.
Yeah. Okay, thank you for the question. So, I mean, so to start off, right? So what I'm gonna explain what is cross learning. So some of you might have heard about cross training before. To have a better understanding of cross learning, so I will explain a little bit of cross training, because its meaning, it's kind of like overlapping with each other. So cross training, it's about developing employees, right? So to improve the business and customer experience. So it's allowed the employee to expand their skill and knowledge on a job, because they work on a new project and gain the skill necessary for specialization or a more senior role. So to look into the meaning, I am elaborating the meaning of cross learning, so which is specific for nurses or nursing student. So our goal is actually similar to the cross training for cross learning. So cross training that I mentioned earlier, that it is about developing employee to improve the business and customer experience, right? So cross learning goal, it's about developing and sharing our best nursing skill practice to improve our patient experience and hospital development, right? So therefore, cross learning, it's about expanding our nursing skill practice across country, so that we are sharing our best practice and different perspectives when providing healthcare through a new project or scenario. So for example, like this, International Nurses Day 2021, A Voice to Lead. I'm giving this as an example because all of us here have been sometime doing this collaborative work together in this project and this forum, right? So we have been having a discussion about similar or different nursing practice about, between Indian and the US, right? And it's very fascinating. So at the point, so I hope that, at some point we're continue to do this similar project to continue education ourselves, sharing best practice and knowledge, so we can, at one point, generally make our community and globally better in healthcare. So.
Yes, thank you. So just one point. So cross learning is within the organization. Okay, so a medical surgical nurse, we want to train them to a critical care nurse. So that is within the employment. Cross-cultural or intercultural, or what is that, inter-country, what we are doing right now to share the best practices, to learn the best from both sides, right? And to adapt and to improve the nursing care, okay? So that is what I just want to contribute. If anybody want to contribute anything on this?
Ashley? Yeah, I think we'll move on to the next area of discussion.
Okay, thank you. So the next one, that's our last question. Yes, the question will be asked by Taruna and Lima, and will be answered by Joseph and Yasmin, and Dr. De La Cruz will be moderating that.
Keeping the current situation in mind, I would like to focus on the mental health of the nurses. So my question is, how can we sustain the emotional strengthening of the nurses, especially in the pandemic time? So
Okay, Taruna. This particular question is very close to my heart, you know. So yes, I would like to talk about the emotional strengthening of nurses. So first of all, why this particular thing, that emotional strengthening of nurses, it's important. You know, as nurses, they care for everyone around us. Often we neglect our own needs, but nurses are facing mental health issues, you know, due to many things like high workloads, as Manjeet mentioned, low nurse to patient ratio, violence, lack of personal protective equipment, and many more things. Uh, I just read that in January 2025, International Council of Nurses drew world's attention to the evidence showing mental health issues and psychological impact on nurses due to this pandemic, COVID-19 pandemic. And International Council of Nurses called this phenomena as mass traumatization of the global nursing workforce. A recent survey by International Council of Nurses found that 20% of the National Nurses Association they reported an increased rate of nurses leaving the profession in 2020. So therefore, I feel that this issue is of a great concern, you know, for the future of healthcare all over the world. And in order to strengthen the nurses, I feel that effective representation of the issues of nurses should be done. Government should also take steps to solve the issues and problems and demands of nurses, and steps to protect the rights of nurses should be taken. Also, things like promoting workplace wellness can be done. There could be a provision of breaks in between work and break relief coverage as a part of daily staffing. Another thing is we could encourage open communication with the fellow nurse staff, with the other healthcare workers, with the supervisors. Another thing, like we could, build the staff, motivate the staff, and increasing the staff morale. We could also do some recreational activities like organizing camps, yoga camps, meditation camps. I think these things could be quite helpful. So, Joseph, would you like to add something?
Definitely. Thank you, Yasmin. And thank you, Taruna, for that question. So I believe that emotional strength comes from having a strong mental health. And like Yasmin mentioned, there's several barriers that can contribute to the steady decline that nurses face on a daily basis. Like it can range from a toxic workplace environment to the rising death tolls in the hospital. And when tensions rise, like nurses are not in their best mental health, like they can't keep their composure. So this is the reason why me and Yasmin, when we were talking about this in our chat, we believe that there should be trained psychiatrists and psychologists available in each hospital to provide that professional mental support for nurses. Because it's one thing to have a support from a fellow nurse, but it's a different type of support having from an actual, person who studied psychology. You know what I mean? And I also believe that these trained professionals can provide the proper education about coping skills that nurses can utilize, not only in the healthcare field and in their practice, but also outside of their daily life. I believe in this quote, when they say, if you give a man a fish, you feed him for a day. But if you teach a man to fish, you feed him for a lifetime. So if you teach these nurses how to cope, they might not even need the mental health professionals to, do the work for them, because they already know what to do to cope with the stressor that they're facing in life. So I think that's super important. Judging from my personal experience, I took mental health nursing last semester, and I learned so much about coping skills, like things that, we do, the negative way of thinking, like just terms I've never heard of before. And then just learning about that makes me more self-aware and more conscious about, like, okay, this is what I'm thinking and this is what I can do to stop from, get out of that mindset, basically. So I think definitely self-awareness is one thing that nurses can practice in order to better cope with the daily stressors that they're facing. So the problem now is, how are we going to implement this? It sounds like it's a lot of money. Let's be honest, money can be an issue. But this is the thing. I know Leanne and Rachel were talking about cost efficiency when it comes to nursing specializations. And, you know, with that money that we save from these nursing specializations, maybe we can use that to better fund for mental health support for nurses, and hospitals may use that fund to hire the appropriate psychiatrists and psychologists that nurses definitely need to deal with daily stressors or PTSD. So I would like to close by saying that you can't take care of yourself if you don't take care. No, let's backtrack on that. You can't take care of others if you can't take care of yourself. So we should definitely advocate for better mental health nursing. You know, mental health.
Very good points, Yasmin and Joseph. So we have to know the facts of what's going on right now. We are in the middle of pandemic, very unprecedented time that we all face, like with several challenges. Of course, no exemptions to nurses or any other frontliners. But the bottom line is we need to have that good mental state and mindset, because we cannot give what we do not have. Let's say as nurses, it's expected for us to provide care. However, like if we lack self-care, then how should we be able to provide this sufficient care to other people? So establishing a good mindset would mean that you need to have like a good balance. And then portion of that is knowing the concept of self-awareness. Having a good concept of self-awareness would lead you to, what are my strengths? What are my weaknesses? Facing under so many stressors, like how should I cope, right? What are the coping mechanisms that would work for me? Because with that self-assessment, that will keep you on track on how you would be able to adjust, like normally and pathologically. And it's always good to practice like therapeutic communications, be it like, within yourself, you need to be reflective enough. And then of course, like interaction with others is important too, because there are certain things that we just cannot contain in ourselves. That's why we get easily burned out. So if relaxation or coping would mean I need to take a break, I need to take a vacation, or just like simply talking to a friend, you should find that. Okay, so again, mental health, balance, and self-care are very important to deal with this pandemic situation.
Yes, thank you so much for all the valid points. I also want to say that every employer, now they have to realize the burnout the nurses are facing right now. So I'm saying, like, they have to introduce programs, how to help these nurses, because that has to happen at the employer level, right? Yes, the peer nursing is different, but then the employer has to realize, and they have to invest on these nurses. Otherwise, pretty soon, this, every nurse will go into the burnout situation. And with every challenges they are facing right now. So they have to make sure that these nurses are taken care of very well. And that has to be, if they don't do it, we have to educate them to do that. So that kind of a change has to happen right now. Yes, because we are in that situation. Yes, go ahead.
There's one thing, and this is already implemented in the US, we call it Employee Assistance Program. So in each and every institution, let's say, I decided to relocate, or like I'm highly stressed out, there's family issues. Do I need to go and seek out like a psychiatrist or psychologist for this matter? But with the employee assistance program, they'd be able to help you like financially. If they need to redirect you to consult all those professional help, then they would. So it's actually being offered in the United States.
Yes, the employee assistance program is there. Yes, I get it. But what I'm saying is, these organized, what is this, recreational activities for the nurses, right? What I'm saying is they're not going to do. So that should be something has to be done periodically. Maybe hospital has to come up with a committee to, the hospitality committee just for nurses alone. Right now we need that, right? Yes. Okay. So these are the points I just want to contribute on this. Okay, so I think, you know, that's
We
the
need
end
to
of.
have rewards and recognition program also. The
Correct.
extraordinary contribution should be recognized. Rewards must be given. That will be encouraging the nurses.
Correct. Yes.
Yes.
Right. Just like a pizza party, like a real recognition, like maybe, you know, some kind of financial reward, or like some kind, like they pay for you to, you know, towards a certification that you're wanting to do or something like that, right? Like that you show the initiative, and so then they, you know, kind of fulfill because you're doing your part. Another thing too is to look, maybe they have maybe an NP, like a mental health NP is like looking out for like situations where maybe somebody doesn't realize, but they've experienced secondary trauma or PTSD because of a situation that they dealt with a patient dying or whatever, some kind of hard situation, right? So that before, you know, even if it's something that they're not aware they're getting burnt out, you know, but just all the helps.
Yes. Yes. So thank you so much. And I think we are at the end of our discussion. And I know I am really grateful that we started this conversation, and I really we need to grow and have more fruitful discussions. So, you know, we can groom these emerging nurses. Okay. Yes. Nurses of the future. And we have to widen our thinking. We need to go big on developing these young nurses. Yes.
I think it was really a great discussion. It was an opportunity to interact with the students from other countries. It's a mutual learning experience for the students of both the countries, as well as the faculty members who have moderated this session. And as an extension of this group discussion, each one of us can pick up some area and start working further upon, so that there will be some meaningful outcome we bring out of this focus group discussion. Otherwise, the points which we have discussed will not be given live, or it has to be implemented practically. So when we were discussing, I thought I will take up the stereotypes in nursing. Probably we can do a survey among all levels of nurses, which are all the stereotypes they feel, and what are their ideas to break up the stereotypes. We could go ahead with some kind of a survey research and find out and break the stereotypes in nursing. So I thought I will take up that area and bring out some ways to break the stereotypes in nursing. So similarly, each one of you can choose one area and start working further upon. And maybe at the end of the year, we can meet once again and we can have another discussion. How did we give life to the ideas, what we have discussed?
We are going to work on artificial intelligence.
Great, great, great. Artificial intelligence. Great.
So yes, we will plan on, after the students' examination and all that, when their stress level is down, so we can have another meeting, and then we can see how we can develop this and how we can take that to the next level. Yes.
And we can choose the area which we want to work upon, and let this relationship continue. And let us give some products to the nursing community at the end of this year.
Yes, this is all about improving nursing care globally.
Yes, yes. Yeah.
Thank you so much for the platform, and thank you students for joining. And we are really grateful for your contribution, and thank you so much for your time. Okay, so in both sides, and have a good rest of the semester. We wish you all the best in your nursing career. Dr. Lata?
Thank you. Thank you so much. I really enjoyed this focus group discussion. And thank you, Dr. Tiziana, for the novel idea which you gave, rather than we speak on the theme and we forget about it. I think this focus group discussion has laid a foundation, I would say. This is the foundation, and we are going to build further upon this And we will be showcasing this as a model of learning, focus group discussion as a newer method of learning for the students. And thank you, Dr. Dela Cruz. Really, your knowledge and your contributions and ideas were very good. And it was a wonderful interaction with all of you. And the students, especially the students, I have to thank the students from Los Angeles and from India. I think it was a nice experience, being the principal. I get very less time to interact with the students, but now I know the students personally, and I was so happy interacting with them. And I will take this opportunity to groom them as a mentor to become leaders of nursing in future. I envision each one of them as a great leader. After 10 years, 20 years, they will be mentioning that this was giving an inspiration for them to grow as leaders in nursing, this platform. Thank you so much.
Dr. Dela Cruz, thank you for your, thank you for your contribution and joining the discussion. Thank you so
Always
much.
a pleasure. Nice meeting you all. Thank you so much, Dr.
Okay.
Lata, Dr. Bhaskar.
So
Students,
I'm
anyone
going to,
would like to thank you. We'll give opportunity for one or two
Yes.
students to say thanks.
yes, do you want to say a few words? Please go ahead.
Well, I just,
Feedback about this session. How did you feel about this session? You can give your feedback.
yes, ma'am. Actually, it was very good as I expected. Actually, it was better than that I expected. It was a great learning to discuss all the things across the ground. Actually, we are moving towards developing nurses as people, and it's I'm very happy to be a part of this discussion. No, great learning. Thank you all for this discussion.
Thank you. Yes.
Fiona, you want to say?
Yeah. So yeah, thank you so much, Dr. Bhaskaran, and like for everyone, Dr. Lata, Dr. Dela Cruz, and everyone. It's a really great experience. I thought I was not gonna get anyone to come along with me. Thanks to all my classmates. I appreciate all of you to be here with me and take your time. I know that we have a lot on our plate too, but you here with me and then share experience and share like knowledge. I really thankful for all of you and thankful for nursing program that you provide these opportunities to for all of us, for this student to kind of know more, grow more and become more what we, go beyond we expect that we can be. So now we know we can do anything we want to do or we want to be, and just working together toward everything that for the future, for the better. And I mean, if any of my classmates want to say anything.
Yes. And then anybody wants to contribute anything? Anybody want to say anything?
I do, actually.
Yes, go ahead.
Yeah, thank you. I just want to say thank you, Dr. Lata, Dr. Bhaskaran, Dr. Dela Cruz, for this amazing experience. It's so insane to me that I went into this field that it was not my first choice. Nursing was not my first choice at all. And I never expected, and nursing just exposed me to so many things. In my 24 years of existence, I never would have expected that I would be talking to people from India about different things about nursing. So it's just blowing my mind, and I'm so grateful for this experience. So thank you, everyone. It was so nice meeting all of you. You guys are awesome. Honestly.
Yes, thank you. Thank you so much. And, what a good thing, because I know COVID has really caused so many problems, but we would not have got a chance to meet each other and have this discussion. So that's a good thing. We just cross all the boundaries and then we are able to, have a discussion. Yes, wonderful. Okay. So I think this will be end of discussion. So Dr. Lata, can we just stop the recording?
Yes. Thank you so much.